Great. Next up, I'm going to invite Charles Gabriel, and I apologize. I'm going to use more of your civilian title than your government title. He's a predictive analytics and data manager with the Defense Health Agency.
Right. So while you're reading this one, I just want to, of course, introduce my organization's Defense Health Agency is part of the DoD that manages all the active service member and their family, insurance and clinical and healthcare, and readiness, of course, because of the nature of their business. Um, but also, DHA is also interested, and part of the core mission is to influence the society, the clinical society, the health society of all their experience, a large volume of hospital, clinical care, and healthcare and readiness, which is an optimal way of managing care, giving the wellness that the last speaker mentioned. Um, so what I want to talk about is just give you a simple view, but also an appreciation of the complexity behind those views. So if you think about, from an information perspective, the way we collect the health or the clinical history of patient is um, within different domains and different pockets around the electronic health records. But one aspect that is missing from this picture is the environment surrounding those um, specific transaction or events that related to the patient or their history. Environmental determinants, social determinants, and all this good stuff. So this is the clinical view. But if we flip it or dig into the clinical view, there is an engineering and business and workflow views, interoperability, analytics, all the stuff, all those disciplines really critical for improving healthcare. But I just want to mention one statistics and give you one problem and then the opportunity from both disciplines. So according to CDC, there are about 25,000 central line associated blood infection occur in the United States annually. And the mortality rate for the infection is about between 12 to 25%. And imagine if this rate is an air traffic control rate. Imagine the her or the significance of the problem. And I'm mentioning this problem to branch out and talk about the need for high reliability organization, which is a discipline that is outside of healthcare, outside of the clinical care, to make the case that there is an engineering discipline need for managing infection rate. And that's one side, one variable across hospital practices. And aside from the high reliability organization and infections and the engineering part of it, think about the analytics that monitor all the stuff to realize that there is a problem. The second problem I'm going to talk about is, since we are talking about, since we are talking about electronic health records, is the user experience. So, and by user experience, I'm talking here the provider experience using the electronic health records. So despite the fact that we came a long way of using electronic health records, and we are partially maybe interoperable somehow, we are still suffering a problem that the electronic health records represents a burden on the provider side. So there is an engineering opportunity for us to optimize the very, very lengthy EHR or specific notes from the engineering user experience software and so forth and so on. The last problem that I'm going to talk about is population health. And I have been doing population health very closely for military service members who live in in counties and cities and stuff like this. And I can tell you there is a significant, profound effect on the service member where the environment they live in, the resources they access, the social fabric of the society or county or city they live in, behavioral health. If you live in rural area, you will tend to have a specific characteristic over the city. If you look at statistics, you will see a lot of correlation between rural area and suicide. With the exception, some rural area, you will not find a high suicide rate, and I get to experience that firsthand. And the reason is because those society have very, very strong social fabric. So the point is, when you have an intervention through through policy where you live or where you have a population health, there is definitely a good intervention you can do to improve the health and wellness of this community. Another example is, I was talking over lunch to a group of people about, is that when you go a city and you found there is a smoking habit outside of stores or buildings, and some county, some community, you will find that the certain family will not go and exercise because of the smoking habit around them, and definitely some city and some county took notice of that because they run population health, they run good analytics, and they intervene with a new policy by even prohibiting smoking outside. So the point is, there is definitely an engineering opportunity. And since we are talking about electronic health record and capturing all the history of the patients, it's a prerequisite to have a quality data, a quality capturing of all the history of the patient to realize a precision medicine. If you think about it, precision medicine is, in a simple way, a way to understand the unique problem of the patient, giving their biological and specific problems and the specific environment they are in. And the only way to achieve precision medicine is to capture good quality of information, good health records that is friendly to the provider, and tracking all possible events, clinical and health events. And I hope that will touch on the opportunity and the problems in healthcare, but I have more details, and if you want to have a side conversation, I'll be happy to entertain that. Thank you.